Welcome to The PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in. Welcome back to another episode of The PA is In. Today's guest is Ilaina Moyer. Ilaina is an ER PA turned plastic surgery PA who's going to share with us how her strong work ethic and big goals, how her ability to take chances and do things even though she felt afraid, paid off big time in her career, and she's going to encourage us to do the same thing. We're going to touch on mentorship in medicine, culture, and collaboration, all of these things that you've been wondering about and maybe struggling with at your current workplace. Without further ado, here she is, Ilaina Moyer. Awesome. Well, Ilaina, welcome to the show. Thank you so much for being here today.
Thank you so much for having me. It's a pleasure.
So tell us about you, how long you've been a PA, and a little bit about this path that you have been on in your career.
I've been a PA, strange to say, for 17 years. For the most part, I've been in two specialties, emergency medicine and plastic surgery. I spent the first half of my career in the emergency department, which I just loved. I learned a ton, but eventually I really became burnt out. It was high stress. The schedule was tough. At one point, I really felt like unhealthy. I wasn't sleeping right. I wasn't eating right, and I couldn't get on a path to where I can make that work with the rotating schedule and the high stress. So I felt I needed a change, and my main goal for the change, I really didn't even know what specialty I wanted to go into. I just wanted something Monday through Friday. I wanted something more regular. So I kind of like stumbled upon this inpatient plastic surgery job. And I got it and I took it. It's the job I have now, but it's weird. It's actually didn't start out that way. This job that I have now, that I'm in that position that I love. When I started, it actually proved to be a toxic work environment. And after 2-ish years, I left. And I left for a faculty position at a PA program. During that time, the outpatient clinic of this plastic surgery department that I was working for needed help per diem. So I actually went over to the clinic and was working there one day a week while teaching. And simultaneously, I was also still working in the ED and working inpatient ortho shifts. You know, we all have these crazy points in our careers where we're trying to do everything. And I enjoyed teaching, but what I learned from that is I just really missed clinical medicine. And what had happened was that the plastics clinic needed a full-time person. So I left teaching, stayed on as an adjunct, but moved into a full-time position now in the outpatient aspect of plastic surgery. And I stayed there for a while, had 2 kids. But during, the pregnancy of my second one, I really wanted more time at home, which, every working mom, I think, kind of comes to that conversation with herself. And part-time was not an option for our family. So I had to be creative about how I could do that. There was an opportunity for me to go back to being inpatient at that time. That toxic person had since left.
Yay!
But at that time, it was still that Monday through Friday, where it was two people. Like one was working in the beginning of the day and one was working at the end of the day. And since I've been in that position, I knew that there were a lot of things that can be better about that relationship, not only for the service, for the patients, but also for the practitioner. And what I did was I came up with this whole business plan of how transitioning to two people that would work 12-hour shifts and cover the week would be much, much better for the patients, for the residents, for the doctors, for the nurses on the floor. And I presented it to the APP director and the business director, and they bought it. They said, "This makes sense. Let's do it." So that's what I'm doing now. Was 5 years ago. My youngest is 5, and it's great. We have a schedule where I work Wednesday through Friday, 12-hour shifts. It's a nice job because it's no nights, it's no weekends. So it's a little bit of that unicorn job that we talk about. And my other counterpart works the beginning of the week, and we kind of have a day to overlap and just like kind of compare notes. This is what you got to keep an eye out for this person. This is what's going on for this person. And it's been great. It allowed me 2 days. Yeah, those days are long. When we're in healthcare, those days don't bother me. The 12-hour shifts, I actually rather get the days home than try to squeeze things in, worry about staying late at work, getting things done. And it has allowed me to have really great time with my family. The set schedule has been great for childcare. And I value that time I had when my kids were little, just the adventures we went on and the time we spent together. Now they're in school, so those days are mine. So I'm finding different ways to fill them. But it worked out really great, and I'm still here, and I'm really happy. And it's a great environment where they just are so open to me continuing to grow because I'm just that type of person. And it's so far been really good.
It's wonderful to hear. And there's a couple things about this that I want to point out in case someone was sort of half listening or maybe didn't, catch them the first time that you said. So just because a place was toxic at one point doesn't mean that it's going to be forever. So sometimes when you're in a toxic work environment, it is truly identifiable. Like it's this specific dynamic or even that specific person that is making this place untenable or somewhere where I can't continue to work. And if you can identify that when you're in it, or even from the outside looking in, like, oh yeah, I would never want to work with that person. If something changes and you can fill that role without having to work directly with that person, it's usually not, I couldn't do the job. It's usually I was unwilling to keep working with so-and-so in such and such situation. So it's wonderful that you were able to sort of leave on good terms, like go in an outpatient setting. And then when the time was right for you and when you felt called to kind of go back, that you were able to go back into, an environment that was working for you.
Yeah, I think that's when I reflect on it, that's one of the points that I feel would help, someone younger is, don't close your door on everything, do what's good for you, be professional, don't, leave on a bad note. And you never know, like there may be things that you really liked about that you may go back to when things have changed or, at a different time in your career.
Yeah. Yeah. If you can stay on good terms, if at all possible. And one, because you might want to go back there. And two, because medicine is a very small community. And if you leave in a not great way or leave things not great, that person potentially knows someone in the future who might be looking to hire a PA. So if you can just stay on good terms, like always a good move. So as we're talking about sort of if I could tell my younger self something, or like looking back for younger providers or even people who are newer to our specialty, newer to this profession than we are, I want to talk about how important mentorship is and positive role modeling and what we can do, like generally as a profession, each of us individually, to help people who are newer on the scene. How has that served you in your career, and how are you helping other newer grads near you?
Yeah, so I've reflected on this a little bit because, like we had talked about a little bit earlier, we didn't have that when we were beginning these things. I mean, I remember, people didn't even really know what a PA was when I was starting, and now it's kind of just blown up in this very hot job. So I felt that I really could have used a mentor, just like we talked about throughout my life. I didn't really have one just in life in general, but I didn't have that really like one or two go-to people as a young PA that I can go to. I think it was a couple reasons. I think that the profession was newer. I wasn't surrounded by a lot of PAs, and the other PAs that I knew were also new and trying to navigate what exactly their role is going to be. So I think what I did was I just kind of looked for different people. Like I knew my values, I knew what I wanted. I like wrote them down, and then I just kind of tried to look for people that had some of those things. And I might not even have known them really to have that heart to heart conversation with them, but I just observed them and I mirrored them and I took things from that. And I think that that kind of molded me into just this revelation happened a few years ago where I was like, you know, I may be no longer searching for that specific mentor. I'm always, searching to learn from other people. So I don't want that, to get lost. But maybe I've become the mentor that I was searching for. And now I have really enjoyed coming into that role and helping, not only other, APPs, but residents that I work with or students, because I still, am involved in PA education. And I tell them, that they don't have to have that one go-to person, that they can kind of have this like board of directors where they can like they really like something about this physician, or they really like something about this nurse practitioner, but they really like something about this PA or this nurse, and you can just take those, knowing your values, knowing your goals, and kind of modeling it into your own version of that perfect mentor for yourself.
Yeah. There's two things I want to say about this. One is I think I have learned just as much from what I kind of think of as like the anti-mentor. So whether I was a student or early in my career, some of the attendings that I worked for, or people who I even just like consulted with, where I would look at the way that they treated patients, I would look at the way that they treated colleagues or other people, and I would say, wow, I never want to make anyone feel the way that that person just made me feel, or the way that this person spoke to this patient. And I would take that, and some of those experiences were very profound for me. Like that was like, whoa, I never want to make a patient feel small. I never want to make them feel terrible about their disease process. Like we can help to empower them to make the appropriate lifestyle changes without berating them about what they've done up until this point. And so I would say, especially if you're a student or a new grad, look out for the anti-mentor and sort of, think about what they're doing and try to do the opposite. And then the other thing that I wanted to say is that it doesn't have to be, one person, or it even doesn't have to be someone that you know. Like it can just be someone that you see and you respect within the hospital. And I have sort of reached that tipping point where I've been practicing 10, 11 years and I just love being a PA. Like this platform is because I love being a PA. It's amazing. And I will have a lot of people like in my office, like patients of mine, they're like, oh, you're a PA. My niece wants to go to PA school, my granddaughter, my friend, my this. And I give out my personal cell phone number, my personal email. Like if there's any area of my life where I have poor boundaries, it's with potential PA students, because I had an experience shadowing early on that helped me to decide that I wanted to be a PA. And so I'm like, tell them to come in over spring break. Like I will gladly precept them. I want them to shadow because I want them to have a great experience getting to know like what it is that we do, or a certain aspect of what it is that we do. So that to me has been very rewarding for me also, because I get to say like, here's this profession that I love. Like, here's what's so great about it. But I think that medicine, in a lot of ways, medicine is very hierarchical, it's cutthroat. Training leads residents to get, treated poorly, who become attendings, who treat residents poorly. So if you can personally break that cycle of like, well, I had to figure it out and nobody knew what a PA was back then. I had to do it the hard way, and so do you. If you can instead turn around to the people coming behind you and say like, hey, here's what's worked for me, or here's how to navigate this, or here's who you call, or this is the nurse that's helpful with that. Those little things are so helpful for the culture of where you're working and for other people to feel seen and heard and included. It can change the whole dynamic of your group. It can change the whole dynamic of your hospital.
Absolutely. And I think that a great point that, you said is it can be something that's little. Like it can be that nurse to go to, or this is where you find this pathway, or and whoever you're giving that information and advice to, it may just make their workflow a little bit easier and them have more time to, do something else that they may have wanted to do within their career. And I think one thing too that I didn't realize and that I don't want, to write off is that it also doesn't have to be. I think when you think of a mentor, you automatically think of someone that's like older than you or, more experienced than you. That doesn't always have to be the case. I mean, I learn from the residents all the time, even though they, are like, we're learning from you. I'm like, oh, well, it's a two-way street. And, they're younger and they're motivated, and seeing those things also helps me be a better mentor to younger PA students, I think, and younger working moms. We have, my kids are getting a little bit older, and we still have these young women who are PAs and having babies and are trying now to figure out their trying to figure out their career, but now they're trying to figure out their career with kids. And I love talking with them and trying to work through, what can work for them so they feel good about both, sides of the bridge.
I've never done this before, but I'm going to share something intimate, literally about my intimates on the podcast. After trying Vibrant Body Company's certified clean first layer bras and underwear, I threw everything else away. Life is too short to wear bras that don't fit. So schedule your virtual fit consultation with their master bra designer, Heidi. You get to Zoom, do live measurements, and find the exact right fit for you before ordering. Use the link in the show notes or the discount code Tracy15 for 15% off your Vibrant Body Company order. Make sure you try the thong and the semi-demi everywhere bra. You'll thank me later. I think that is such a powerful aspect of like almost removing the gatekeeping, right? It's not about labels. It's not about how old or young someone is. It's not about what their role is within the organization or yours. Like you helping them ultimately helps the patient, and also it helps all the patients they're going to see in the future. So it's not just because it feels good to mentor people. It's not just because it makes our patient care like better and safer, but also it has this ripple effect. And the way that we treat people matters. And that quote of like, they don't care how much you know until they know how much you care. And just that's true for patients, but it's also true for our colleagues. And so if you get that, if you're empathetic with them, if you're compassionate with them, if you give them the benefit of the doubt when they got something wrong or just didn't know something yet, then they're going to come to you when they really have a problem or when they need other help. And it just creates this community of collaborations. We're going to jump ahead a little because this is something that we wanted to talk about later on in the episode. So if someone is listening to this and they're like, hey, Ilaina, hey, Tracy, that sounds amazing, but you have no idea what it's like over here. I don't work somewhere that has this community of collaboration. In fact, I work somewhere that is like a community of competition where we're one-upping each other, where we're not on the same team, where we work in the same group, but we're always trying to sort of show off. What can we do if we're working someplace that doesn't inherently already exist to help to create it?
That's great. And I feel like I've been there in this situation. And I do have some things that I've done that I think were really helpful in those times. Um, the first thing that you can do that kind of takes, I would think, take away that competition is in between some ER jobs, I had this little stint in a rheumatology office. And it was just me, only PA, with kind of a bunch of, I was young. It was I was young in my career. And then it was just like some older physician, older office staff. So I didn't really have anyone there to connect with. Wasn't really in competition with anyone, but just didn't have anyone else that was kind of that kindred work spirit. And what I did was I actually ended up joining a patient advocacy group, which had like it had patients. So we go into this because at the end of the day, I really love talking to patients, and I really just love helping them in any little way that I can, learning about the person behind the disease, all that stuff that we get into this for. And I joined this patient advocacy, for this one disease, this one rheumatologic disease, but it also included other practitioners, nurses, doctors, PAs. And it just became this community outside of my office where I can still talk about what was pertinent to what kind of medicine I was practicing. But, I didn't get my daily 9 to 5. So that's one thing that I found. So, if you're in this environment where you want some kind of just collaboration and not competition, you can always seek that out. And another thing that I had done was I joined my local chapter, the Pennsylvania Society for Physician Assistants, and this was pre-pandemic, so I don't know how this looks right now, but they had a ton of events. And I would go to these events and I would go alone. I purposely didn't bring friends because then I really wouldn't meet anyone else. I wouldn't get to swap experience. Oh, I'm in this environment that works for you. And I learned so much in just going to these little dinners. And, most of the time it was a CME dinner that was paid for. So that's like an extra bonus. And I just really got to meet other people within my geographical area that were just doing different things and learning from each other. And we just bounced, ideas. And that got me out of some situations, that I wasn't necessarily loving or, having that great work buddy. I also did at one point, and this was when I very first started the plastic surgery job 11 years ago, when I had a toxic environment, so I wasn't connecting with anyone. I did join some hospital-wide committees. It let me to meet other, APPs within the system because we were small. Now we're huge, but we're very small when I first started, and I really got to work on a lot of great projects. Some are still, going in the health system today. I've just stepped back from them because I've done other things. But it gave me a release from that environment that I was in. And I could just kind of breathe a little bit and talk to someone without worrying what's their motive, all that kind of stuff. And I think it's great to lean on past schoolmates. I have a little core group of PAs that I went to school with, way back when. And, we don't see each other that often. Our paths have kind of gone, but we make it a point to get together. And that can be really an area of support for you too.
Yeah, I think it's sometimes hard to change the culture where you are, especially if you have someone who's toxic within your group or generally that you're not in the habit of being supportive of each other. But if you can look outside of those things, not all PAs are like that, right? Not all nurse practitioners are like that. So if you can find someone outside of that group to connect with and support you, more power to you. That is so awesome to be able to do. And I think having those people who get it. So I have a wonderful husband who works in corporate America, who does HR systems, who's just I can come home and start talking about stuff and he's like, what? He just doesn't understand because he's not trying, just because he doesn't either know the words that I'm saying or understand how the healthcare system is just very different than corporate America. And what we do is just not the same. So getting in community with people who get it, who get you, who you can either text or voice text or call and just say hey, I want to talk through something with you, or I had a thing happen and I'm just not sure how to respond or how to process this, because things are going to happen. You're going to have patient encounters. You're going to have encounters with colleagues. You're going to have encounters with attendings where you're like, how, like, what, like, where do I go from here? And having someone who gets it and can give you some like good advice is super, super valuable.
Definitely. And sometimes it's beneficial to have that person not be right in your organization or your department with you, because they'll have a different perspective. And you're totally right. Throughout your career, you're going to, have these like, oh my God, what is going on kind of moments, and stepping back and talking to someone you trust not only is therapeutic, but you probably will get something out of it.
Yeah. Huh. So you made a big switch when you had, it sounds like you had spent the majority of your career in the ER, that even though it was like crazy and unpredictable, that you were personally very comfortable there. And that when you said, hey, my family needs some more regularity, I need a better schedule, something different, you made the switch from ER to plastic surgery, which is a pretty big jump in specialties. So I want to talk about perseverance and doing things outside of your comfort zone. And how did that switch feel after all of those years working in the ER? Was it hard for you?
Yes, I love this topic, and actually the switch was very humbling. I'll be honest. I was like, "Ooh, I'm an EDPA. I know everything. I do all these things." And it was an inpatient plastic, so it's a little bit different in the fact that it was tertiary medical center, cancer, trauma, reconstruction, and they were sick people. And often, we were managing these, patients with a lot of comorbidities and a lot of complications. And I learned a ton when I transitioned into that. And it was a lot more challenging than I had thought. And I didn't, I loved it so much. It was, I went from the ED where I was really just seeing a snapshot of these people. And here I was seeing these patients carry through. And they were actually like, they turned into like lifelong, not really like lifelong, but a long time patient that you really got to know and got to care for and help, through all aspects of their treatment. Especially we were kind of at the end when you were getting the reconstruction. Um, so that for me, the transition was challenging. The transition humbled me a lot. And but I enjoyed adapting to it, and I enjoyed learning. And one of the biggest things, and don't get me wrong, I don't do this easily. I still give myself pep talks about this. And I know my pep talk is like, do stuff that scares you. Do stuff that scares you. Put yourself out there. You know, it's okay. Whether it's, putting that, going off topic of medicine, putting that business plan out there, but also like doing a procedure that, you didn't do before, obviously with supervision and all the right stuff for credentialing, but, or, my position has so grown. When it first started out, there was not a lot of depth to it, and I think that was something also that I didn't really like. And there was a culture kind of APPs at that time that didn't adapt to how we are practicing now. And I think that I really grown this role that I'm in to, include all aspects of taking care of the patient, whether it be consults or the OR. And, I still do stuff that scares me every day. And I don't want to lose that. And I want to continue to grow, because at some point, early, I obviously didn't know what I was doing, but now I kind of know what I'm doing, but I still want to find ways that I can just continue to be a better plastic surgery PA.
Huh. I had a similar experience I just shared recently on a podcast when I was doing inpatient urology. I was clamping renal arteries for these complicated partial nephrectomies. And I actually remember saying when I went to plastics, and I was going to primarily be doing injecting. So I do a little bit of plastic surgery in the office, but mostly aesthetics. And I literally said, if I can clamp a renal artery, I can Botox a forehead, right? Which, like, although it is true, is also like, then I get there and I realize everyone's anatomy is different. Like no one wants the same amount of like, paralysis. And I'm like, oh, this is a lot hard. Like, I think everyone's job looks a little easier from the outside looking in. Then you get in and you're like, oh, this is what we're doing. Like, this is the thing. I didn't know. I remember when I first took my urology position, I like in theory knew that the urology team was who they call for a difficult Foley, but then I got there, I'm like orienting and they're like, "Hey, we have a difficult Foley, like we're going to the OR to put it in." And I'm like, "You want me to do what?" Like the last time I put a Foley in was in school, and I don't even think I did it that well. Like I was like suddenly the expert at putting them in, and I had no strategies, right? I was like, well, what do we do? And my attending's like, well, usually we push harder, and I'm like, okay, that's one try, like we'll try that. But there's all of these nuances, and I do think there's something to be said for the more that you try, the more that you're willing to learn, the more that you're willing to like not know how to do and say, hey, I've never done one, but I want to learn. Let me watch you do this one. The next one I'll do. And then after that, I'll feel comfortable to do them on my own. When you say that, and it makes you like, oh, I have to learn something new. But then also you get the joy of conquering something new and of feeling great about the way that you showed up and took care of those patients.
Yeah, it's always scary at first, but then when you do it, you just feel so good. And it's funny, I can really resonate with you just said for two reasons is one, when I was working in outpatient plastic surgery, I kind of had the same impression about breast implants. I thought, oh, how can breast implants not be complicated? They are very complicated. There is a complete science to picking the right ones and putting them in. So totally was like, wow, I really underestimated this aspect of breast augmentation. And kind of the same thing with we cover hand and facial trauma as part of plastics. And in the ED, I was always taught, oh God, you got to get the hand surgeon there. You got to, and now I'm going to these consults, and I'm like, whoa, I'm the person I used to call. So it's very interesting how these different things in your career then come back and give you different perspectives about things.
We interrupt this broadcast with a very important announcement. You are not making enough money. Your practice and your physician do not understand the value you are adding to their patients, and therefore, you aren't earning what you're worth. If in the past your requests for a raise have been met with one single word, no. If you're working more hours than ever and seeing more patients, but you're not making any more money and you're feeling pissed about it. If you feel like you've hit the ceiling of your income band, this guide is for you. I've compiled the 5 most costly and most common mistakes that PAs make when asking for a raise, and I've told you how to avoid them and what to do instead. Download your free guide at tracybingaman.com/mistakes. Yeah. And that more and that when you're credentialed and when you're in that new specialty, sometimes you look around. I remember feeling like this when I was a new mom, like, where's the parent here? Like, I'm like, it's me, but I didn't know. Like, I'm like, based on what? I don't know what I'm doing. And that's how I felt like the first like couple of months in a new specialty. I'm like, they're like, oh, we called urology. I'm like, oh, that's me. Like, I don't know, you don't always know exactly what you're doing, but like there's a team and you can, get help with that. And I feel like the same is true anytime you're the first. So anytime you're the first leader, anytime you're the first PA in a group, have you had those experiences in your career where it sounds like you were the first PA who really said like, hey, I want to do more on this inpatient team. I want to learn more. I want to be involved in all aspects of these patients' care. So how has that gone for you when you've been like the first one to do something?
I think it's been great. It's been great for myself. And I also think that it's been great for the service. There was, a stigma, I think, around some of the roles that the previous APPs had. And I think it caused actually some kind of resentment between, oh, you do this, I do this, you do this. Clearly there has to be some like boundaries, but I didn't want to practice as a PA that didn't do every aspect of medicine. I just didn't want to. I didn't want to like say, oh, this is my job, this is your job. Like if it was involved in if it was about the patient, I wanted to do whatever I could to my, top of my practice for that. And I think that me doing that created a road to let other APPs do that felt that they wanted to do that, but maybe it wasn't the kind of culture. But it also kind of opens a better line of communication and mutual respect with the residents and nurses. I think just with the people within the hospital system, and it really ended up being it's a nice environment. And I think that's one of the things that also keeps me there because I've been in those toxic environments, but now I'm in an environment where it's completely supportive. Just like you said, if I don't know how to do something, but I want to know how to do something, I pretty much have like 5 or 6 people that I can call. And they'll be like, okay, no problem. Let's go through this. Let's do this. And I do that for other people as I, gain skills as well.
Yeah, I think early on in my career, I underestimated the importance of environment and who you work with and how supportive they are. And I overestimated how much the specialty matters. Like I remember getting out of school and being like, I want to do general surgery specifically. And what I should have said is like, I really like surgery and I want to work in an environment where I'm supported and I can learn and my attendings are respectful and I get to do cool stuff. Like that should have been more of a concern and less like this specific specialty, because that's what makes or breaks a position. And that, like you said, that's what keeps people away or keeps people there if they see like this is a good supportive environment or not. So as we wrap up here, I'm curious, you're now 17 years out, your PA career is like almost an adult, can almost like legally vote. And what if you could go back and tell your new graduate self, what would you tell yourself? Like, hey, don't do this, don't sweat this, focus on this. What would you tell the younger version of you if you could?
I mean, like we've kind of already talked about, I'd tell her to like, do not be scared, and do those things that scare you. Learn everything you can. Be the sponge. Take all the opportunities that you have in front of you to grow. And some of the opportunities you might take them and they're not for you, and that's totally fine. Not saying that you have to like do that, but figure out if an opportunity is there, try it out, figure out if it's for you. If there's a learning opportunity, unless it's something that you completely don't, are not interested in, go for it. And it is scary, but give yourself that pep talk and you will always be happy, even if you do it and you're like, I don't want to do that again. But you'll know. So I would definitely tell her that. I would also tell her that, be okay with failures or, things that might not have gone right for you. But don't accept defeat. And I'm more talking about the, career logistics versus like direct patient care. That's a little bit different. But, some things don't work out, just like my career path. It didn't work out 11 years ago, but here I am and it's working out. And, my goals initially, like even when I became a mom, were to have more time at home. But I had to be creative in getting that goal. Like it wasn't just as simple as like, I'm going to work less because I wasn't in I didn't have that opportunity to do that. But I still got to my end goal and I still got more time. I just had to be creative about it. I just had to, take a different road and I had to put myself out there to get what I wanted. And even though they took my business plan, I had given a couple other proposals in the outpatient clinic that they rejected. I wanted to work for tens. They're like, well, we can't support that as a clinic because, the front desk person goes home at 4:30 or something like that. And so, we always keep trying and, you know, molding. I'm trying to think of what I want to say. So this may be a point where I have to and I think that's it. Just, knowing what you want. It might not be in this perfect bow, but molding yourself, making your situation work for you.
Mm, yeah, I have learned that over the years too. And I ask this question a lot of my guests on the show. And as I reflect on our conversation, I sometimes come up with, I'm like, oh yeah, there are other things that I wish I had known when I was a new grad. And I think I would tell myself, just expect to be surprised. Like, expect to be surprised at what you like or don't like, at where you end up, at, what prompts you to make a change. And I think I would tell myself to be more proactive and in tune with, hey, is this working? Is this not working? Is this going to work for our family long term? Is this someplace I stay for just a few years? And to not really sit back on my heels and just expect, like, I'm going to get a job. I'm going to stay here for 20 years. I'm eventually going to retire from here. But like, hey, this is working. And then periodically ask yourself, is this still working? Do I see this working long term? What's my next move? And I think it's not that, like, what's my next move is manipulative. It's just, do I want to become a leader in this group? Do I want to make a lateral move to another specialty? Do I want to be more OR based? Do I want to do more rounding? Do I want to move to outpatient? Like, none of those are bad. It's just evaluating, like, what's going to work for our family, like what schedule is going to work that still provides the level of income that we want and need during this season. When your kids go to school, it might change. When they leave for college, it might change. Like, if something happens with your spouse's employment, it might change. But all of these things to just be like more on your toes, more agile, like more proactive and less reactive through your career. Because you would never take care of a patient and just be like, well, they had a fever. I guess we'll just like wait and see, I guess we'll just wait and see what happens, right? You're very proactive when you think about like your patients and their trajectory of disease. But in our careers, we're like, I think we wait too long. I think we wait to make a change until we're so frustrated and so fed up and we can't work one more day. Whereas if we got in the habit of evaluating how we feel, evaluating how this job is making us feel, that we would make changes sooner and in less of a panic. At least that's true for me.
Definitely. I that was something I would tell myself too, is just to not worry. Stop worrying. It'll be okay. And, yeah, don't react, but your career can be fluid. Your career can move in and out of certain things that work for you at the time, or maybe your goals can change, and or your goals may not be the same anymore. And I mean, even as a PA who's 17 years in at my with plastics now for 11, and my current role for the past 5, is I'm still always having, and not that I'm not content, but I still always have that, like, oh, I heard, this person is doing that. Oh, well, that's really cool. I want to learn more about that. Not necessarily, maybe exactly like you said, maybe in 5 or 10 years, my career might need to look different. And I think just that's why I also like this whole like work life flow kind of label versus work life balance, because I don't think it's unrealistic to think you're going to have this like scale where it's just going to sit, even. No, it is this flow. It's the flow of your life. It's the flow of your career. And are they, I'm a yogi, so that's what I use. Are they moving, in that kind of way?
Yeah. And how does it feel? And the other thing that has surprised me is there have been seasons of my life that have been, from the outside looking in, super successful, right? Like, I was rocking the job, I was making the money, I was in the department that was respected and valued, and I felt like crap during those seasons. Like, that you can have these external measures of success, but are you checking in, like, how does this feel? Like, do I feel okay with the time that I'm getting home? Do I feel good about how I'm showing up when I do have time to spend with my family? Because sometimes success feels terrible and you can like back off or do something different or change something. And someone from the outside looking in might say like, oh, like she took a step back. And you're like, no, like I took a step in the direction that I needed to during that season. So have you had that experience where like you making this change in your schedule or other things where people are like, she's like almost part-time, or that when things looked great, they actually didn't feel so good?
Yeah, I mean, I think it kind of happened twice. I think the first one was that, like, just like you said, when I was working in the ED, I felt like I was at top of my game and I was learning all these things. I was seeing all these good things, but I also didn't like take care of myself at all. I mean, I had no sleep pattern. I, was, having to take like, Benadryl to sleep. I couldn't sleep during the day. I couldn't sleep during the night. I wasn't like eating right because I was just, grabbing quick, unhealthy meals. And I think that everyone probably that I would have talked to that didn't know that would have been like, "Oh, it's so cool. You work in the ER and you do this stuff." But it wasn't. Behind the scenes, it wasn't like that. It just wasn't like that. So that's why, I made that decision and transition for myself. And I mean, I think there's always going to be a little part of me that mourns that ED person because I liked it, and that's okay. It's there. I had it. It'll always be my experience, and now I have other wonderful experiences. And the biggest thing I think I was worried about when I went from the outpatient into the inpatient was I didn't want some of my attendings that I was working with in the clinic to feel that I was like abandoning them, or, going to something that was, even though I think that they all would have been supported, but I kind of had this in my head that they're like thinking that I'm taking like the easier route, or I'm taking like the, more, cushy schedule route, or something like that. And none of them ever said anything like that to me, but I held on. I was worried about, I had these amazing relationships with them. And I was worried that they weren't going to be the same now that I wasn't working with them on a daily basis, one to one. And honestly, it wasn't the case at all. It was actually, they've been so supportive in me growing this role, and it's been the opposite. So just, telling yourself to not go to those places sometimes when you make these transitions.
Yeah, don't worry about someone else's non-existent opinion of you is generally a good move. Well, Ilaina, thank you so much. I think this has been just like, it has felt like we just sat down for coffee and we talked about our experiences. I'm sure our listeners are going to see themselves in our stories and really feel encouraged by a couple of maybe older and maybe wiser mentors from inside the PA space. So if people want to get in touch with you or hear more, what's the best way for them to get in contact with you?
So they can email me. I have an email. I'm Moyer, PAC@gmail.com. I'm happy, to talk to anyone that might have some questions, or there might be navigating their journey, or might have something to tell me like, oh, I'm totally open to that too. And I do have an Instagram account. I'm Moyer, PA_C.
Awesome. We will link those in the show notes. Thank you so much for sharing your time and your wisdom with us today. We really appreciate it.
Thank you so much for having me. It was a great opportunity.
What a powerful and uplifting conversation about the need for more collaboration and a stronger community where we're willing to mentor others, where we're not gatekeeping information, where we're helping each other and new graduate PAs and other people in medicine, regardless of their role or their title. My hope is that you feel seen and welcomed into this community on The PA is In. If this episode has been helpful to you, I would so love it if you would leave a review. Otherwise, I'll catch you next time on The PA is In. Congratulations, you've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.